What is Asperger's syndrome? Is neurodivergence about me? Is this autism? Let's figure it out. We begin by understanding what autism is. The term was first used in 1911 to describe a phenomenon which psychiatrists believed was a childhood variant of schizophrenia. The word autism itself comes from the Greek autos, meaning self, reflecting observations that such children seem disconnected from the real world, closed off in their own. Autism was later recognized as a separate disease, distinct from schizophrenia. Today, the diagnosis of autism encompasses difficulties in learning, particularly in the area of language and speech, problems with verbal and nonverbal communication, avoidance of eye contact, repetitive movements, specialized and often obsessive interests and behaviors, difficulties with emotional control, and extreme reactions to stimuli such as light, touch, or noise. People with autism sometimes have unusual abilities, such as outstanding memory and the ability to memorize large volumes of numerical or visual data. Some of them can calculate mentally as well as calculators. These examples, as well as various movies and TV shows, have created the impression that the aforementioned symptoms of autism can be a sort of prize for genius. For example, the protagonist of the book The Girl with the Dragon Tattoo, Lisbeth Salander, is highly introverted and has difficulty making friends, but she is also a very talented hacker. The hero of the series, Mr. Robot, Elliot Alderson, also has a spectrum syndrome. However, the idea that all techies are somewhat artistic is not true. In reality, the proportion of people with a high IQ among people with autism is about the same as among the general population. This mix of cognitive problems and abilities led to autistic people once being called idiot geniuses. However, since then the word idiot has changed its meaning and is now perceived as an insult, so the name of the disease was changed to savant syndrome. Most people probably never heard about autism until Dustin Hoffman showed it to the world in the film Rain Man. The movie itself was inspired by the story of a man named Kim Peek, who was one of the most famous savants. However, in 2008, a group of doctors, studying his brain MRI scan, concluded that he was not autistic, but most likely suffered from a genetic disease associated with X chromosome abnormalities. In 1943, Hans Asperger described a group of children who had social and communicative difficulties similar to autism, but without the same problems with language and cognitive functions. This alleged high-functioning autism later became known as Asperger's syndrome. After 70 years, psychologists concluded that there is no clear distinction between Asperger's syndrome and autism. Asperger's syndrome is no longer used as a separate designation for a specific condition. Instead, we now speak of autism spectrum disorders, or ASD, which encompass autism, what was once called Asperger's syndrome, and some other developmental disorders. These disorders are associated with various issues, including difficulties in learning, social interaction, emotional control, repetitive behavior, as well as anxiety, sleep problems, seizures, and an increased risk of gastrointestinal problems. Symptoms usually become noticeable in early childhood and may vary in intensity throughout life. The term spectrum in autism spectrum disorder reflects the diversity of symptoms, not their intensity. The degree of symptom severity is classified separately, from level 1 minimal support needed to level 3 maximum support needed. Many studies show that the brains of children with ASD develop differently, and these differences are typically noticeable on brain scans before symptoms become apparent. For example, some areas of the brain in children with autism may develop faster, which correlates with difficulties in social interaction. According to statistics, about 1% of the world's population have ASD, although in wealthier countries this figure may be higher. And while the number of diagnosed cases grows over time, this does not necessarily mean that the incidence is increasing. Rather, it reflects improvements in diagnostics and increased awareness of the condition. Men are diagnosed with autism about 4 times more often than women. The reasons for this are not entirely clear. Some studies suggest that women may be more effective at hiding their symptoms. Factors such as older parental age, participation in pregnancy, and complications during childbirth may also play a role, while others believe environmental factors, such as the air a pregnant woman breathes and the diet she adheres to, affect. At the same time, there are many myths about the causes of autism, including one of the most widespread, its vaccinations. But all research shows that there is no connection between vaccinations and autism. Because of these myths, many parents refuse vaccinations, leading to the emergence and spread of other dangerous diseases. The main problem for autistics and their families is the lack of social understanding and perception. Many autistics have problems with communication. They may not understand metaphors, irony, and other non-literal forms of communication. They are difficult to understand for other people. They are often perceived as strange or unusual. This can cause them fear and anxiety, and they can face isolation and misunderstanding. Some individuals with autism may struggle with regulating their emotions, leading to sudden outbursts of anger or deep episodes of sadness. This can also include repetitive behaviors, such as hand flapping or constantly repeating specific phrases. Many people with autism also suffer from sensory overload when regular sounds, light, or textures become unbearably intense. This can lead to severe stress and discomfort. On the other hand, many individuals with autism have unique skills and talents that set them apart from other people. Some have exceptional abilities in mathematics, art, or music, while others may have a unique ability to remember information or notice details that others miss. On the other hand, many individuals with autism have unique skills and talents that set them apart from other people. Some have exceptional abilities in mathematics, art, or music, while others may have a unique ability to remember information or notice details that others miss. Environmental factors also play a part. For example, some studies have found a link between maternal obesity or diabetes and an increased risk of autism in their children. Research has also shown a correlation between parental age and the likelihood of autism in children. With every decade of a parent's age, the risk increases by 18 and 21% respectively. Also, we know about things that definitely don't lead to autism, such as vaccinations. The myth about the connection between vaccines and autism emerged back in 1998, but it was completely debunked in 2014 during a meta-analysis that included 10 different studies. In addition to vaccines, caesarean sections, in vitro fertilization, plastic packaging, bacterial infections, and watching YouTube also do not cause autism. Autism is an incurable condition, but early diagnosis and support can significantly improve quality of life. The use of medication and psychotherapy can help reduce some symptoms. Modern therapeutic approaches are most often focused on the psychological and social support of children with autism and their families. Early intervention can help improve communication skills, speech development, and social activity, and at a later age, help reduce symptom severity. Programs that involve both parents and schools are often the most effective. They help educate those around about the needs and requirements of children with autism and avoid behavior that may be traumatic for them. For instance, children with autism may have difficulties switching from one task to another, struggle with understanding nonverbal communication. They might also use repetitive movements, such as rocking or clapping, for self-soothing. This behavior is called stimming, and asking to stop it can be inappropriate. In medicine, there are some drugs for treating accompanying symptoms of autism, such as irritability, restlessness, anxiety, or depression. Cognitive behavioral therapy may be helpful in some cases. However, there is no one-size-fits-all approach to treatment, as the symptoms of autism can vary greatly. All of this suggests that autism is a mental disorder. However, many people with autism and other neurological differences prefer to avoid the term disorder, as they believe that neurological diversity doesn't imply there's something wrong with them. They prefer the term neurodiversity, which encompasses autism, attention deficit hyperactivity disorder, dyslexia, and some other conditions. Introduced in the late 1990s, the term neurodivergent was proposed by an author as an addition to the social justice movement, which was ensuring equal rights for women and homosexuals, as it should have been always. It highlighted that individuals with neurological differences also had not yet claimed their rightful place in society, and that it was time to stop their stigmatization. However, the neurodivergent movement intersected with the American Social Equality Campaign and acquired extremist shades. By 2013, some representatives of the movement claimed that autism and ADHD were the result of formal and natural changes in the human genome. By 2019, some argued that the real problem was the dominant culture, which set standards for normalcy. These people believe that if you have a neurodivergence, you may blame yourself for the problems that arise, whereas the real issue is the social barriers and discrimination that stand in the way of neurodivergent people's happiness. Currently, social networks are full of teenagers who call themselves schizoids, autistics, ADHD, or simply atypical, and this should not be taken as something bad. However, many ordinary people often overlook those who are different, and in most cases, this happens not because they are bad people. They are just unfamiliar with neurodivergent issues. If you're different from the standard too tall, too short, too loud, too quiet, it will be harder for you to adapt in society. Therefore, if someone's brain works differently, it's not always the problem of the person themselves. The problem might be in the unwillingness of others to make an effort to understand their peculiarities. Most people claiming to be neurodivergent on the internet are actually ordinary people who romanticize mental disorders and try to stand out from the rest. And those who really suffer from these problems often remain silent. Because of this, the neurodivergent movement has faced negative reactions, especially from those who care about people with high levels of autism. There's even an article titled "Against Neurodivergence," which points to the troubling trend of romanticizing autism extended to other diseases, which can be serious, debilitating, and potentially life-threatening. Indeed, certain illnesses like depression and schizophrenia have also been subject to this trend. The author of the article draws attention to the fact that attempts to present autism as a variant of the norm contradict the scientific understanding of this condition. And in their zealous efforts to defend the rights of autists, some proponents of neurodiversity become authoritarian and aggressive, pursuing and intimidating those who dare to criticize autism or express a desire to find a treatment or cure. Indeed, certain illnesses like depression and schizophrenia have also been subject to this trend. The author of the article draws attention to the fact that attempts to present autism as a variant of the norm contradict the scientific understanding of this condition. And in their zealous efforts to defend the rights of autists, some proponents of neurodiversity become authoritarian and aggressive, pursuing and intimidating those who dare to criticize autism or express a desire to find a treatment or cure. A person named Tom Clements, who himself is autistic, stated in his article that many people nowadays identify themselves as autistic, as if autism is a fashionable accessory rather than a severe disorder. He argues that such an attitude has led to the marginalization of real autists who, being disabled, cannot speak for themselves and rely on others. I won't go into details, but understand that this sparked huge discussions on the internet. Until recently, I myself was oblivious to this issue, until I started working on this video. I was struck by the complexity and contradiction of this topic, but I hope that this video will help clarify the situation a bit for you. In summary, autism spectrum disorder is a mental illness that includes what was previously called autism and Asperger's syndrome. It occurs much more frequently than one might think. About 1 person out of 100 suffers from it. Most of these people are able to lead quite normal lives. However, they face obstacles, especially in work and communication. Many of them prefer to call themselves neurodivergent and try to draw public attention to their problems. However, the neurodiversity movement is criticized for downplaying the problems of those who really suffer from this disorder. And once again, thank you all for your views, likes, comments, and shares.